So for females with estrogen, obviously there was and has been a lot of controversy over estrogen replacement, especially about 20 years ago, which has recently just been FDA approved and black box warning removed from estrogen supplementation. Yay! So that being said, estrogen, or in this case, we would supplement with estradiol, which is just one subset of estrogen that does not cause any issues with cardiovascular disease, cancer, and or blood clotting. So when we replace estradiol, we are actually making sure that our bones stay healthy and are not losing their bone density. Super important for us women. The other thing that estrogen does for us women is it helps our cardiovascular system stay very smooth, strong, patent. And that is important because as we age, cholesterol can cause calcification in our vessels. And we want to make sure that our vessels are pliable enough to manage that. Also, estrogen, when we reach the state of menopause, it can help if we continue having hot flashes and or difficulty sleeping, but only when we reach menopause. And I'll talk about that a little bit more in the progesterone segment. The other thing that estrogen helps with is with depression. It is going to help us feel way more alive. It also will help our skin. It keeps things tight and connected. So we will have less urinary tract infections and less saggy skin overall. And estrogen does help decrease visceral fat. And visceral fat is the fat that is collected internally around our organs, or known as the bad fat. So if we are able to decrease visceral fat, we will in the long term have less weight comorbidities such as diabetes, Alzheimer's, dementia, and also able to move around well into our old age.